Hello, my name is Peter Schneider, and it's my privilege today to be talking with Tino Pena. And I just wanted to introduce him for just 1 minute, and just to let you know, I got to choose who I got to invite for an interview. And I've known Tino for a while. He's a very sharp guy at a very good group that's kind of leading the way in his part of the country, and certainly has become internationally known at the Miami Baptist down in Miami. And so Tino is an interventional radiologist by training. I figure because I'm not an interventional radiologist, I'm going to learn a lot from him every time I talk to him. So Tino, welcome.
Thanks, Peter.
And thanks for letting me pick your brain for just a few minutes.
Great, it's a pleasure to be here.
All right, so I'm kind of wondering a little bit, how did you get interested in vascular work in the first place? What was it that pushed you in that direction?
Peter, it's sometimes it's kind of funny. You look back and, when I got into medical school, I was interested in vascular work. My father's an interventional radiologist, so I think that really had a lot to do with it. I had some exposure as a young child. I got to go see angiograms when I was young, and I really enjoyed that part of it. And, really what I liked was the patient contact, being able to speak with patients and treat them, and be able to see, the satisfaction that he got from that. That really, to me, has made a big impact on what I wanted to do. When I was in medical school, I looked at the vascular surgery, I looked into trauma surgery, and I ended up falling back into interventional radiology. I'm not sure why. I think I actually liked the imaging also, and that kind of gave the challenge. So it kind of went full circle.
Yeah. So tell me now, which part of the country did you grow up in?
So I grew up in Miami, Florida. So that's another thing. I'm
okay.
home, and that's a special bond that I have there. I have my family there, and it's fantastic. And all my old friends are still there. So it's kind of being home, and the patient population in Miami. It's I'm a Cuban American, and that's a place to be for that. So that also gives me a lot of personal satisfaction.
Yeah. Oh, that's great. Now, so tell me a little bit about the Miami Baptist and your group there. I want to just get a sense. So I know it's a multidisciplinary group. I know it's a fairly large group. Just give us a little description, because it's a neat model, and a lot of people kind of looking toward that.
I think it's a fantastic model where you actually work in the synergy of multiple specialties together, and different, just not only a multi-specialty group, but really looking for those synergies, being able to work next to a interventional cardiologist in the room next to them. And it's very common where I may call them or they may call me, whether it means, hey, I need a special wire. What am I missing here? They may, right there on the spot, help me out. Or we may go in there and help them out. So it's really, you see how all of a sudden transformations occur with technology. At the same time, we have vascular surgeons also the same thing, working together in the same room, and working on patients together. And it's fantastic. The model now extending into cardiac surgery and other kind of vascular type of specialties, vascular medicine. I think it shows you how much more you can do and see, and how much more patients you can treat and treat effectively. It's a great model. I'm really privileged to be there.
That's great. So, okay, so obviously you come at it from a radiologist's point of view. You mentioned before, maybe it was in some respects the imaging that got you interested. So are you are you like a techno geek or any of that stuff? Or tell us about that. Are you Twittering every day, or what?
I do have a Twitter account. I wish I Twittered more, but or tweet more. I think that that social media is incredible. And if, as physicians, if we don't think that it's important to our practice, we're kidding ourselves. And more and more, the impact of social media, I think, is going to really drive, our practices and what we do, what people think of us, an impression of what we do. So I think it's really important. In terms of technology, and I wish I was more of a kind of an IT buff, but it's so. What we do, it's so image dependent that I've kind of grown into that position at the Institute, and give me a great opportunity to start learning all about all these different imaging possibilities and how it really helps us treat our patients better.
Now, so are there any imaging modalities that you're really excited about, but that the average doctor like me hasn't had a chance to see yet?
Today at the show, we're going to be showing basically this overlay technique where you can able to get a CT you might have acquired a year or months ago prior to a procedure and actually fuse it. So when you walk in the room, you already are having this projected, so you don't even have to, you know where the arteries are. And that's pretty exciting. You know, I think there's still a lot of challenges, but I think we're going to continue to work with that. I look at MRA using no gadolinium and how our machines are getting better and better. We're not far off until we start getting some functional information, which I really think is the next step. And even in CT, looking spectral CT, being able to look at the amount of calcium, subtract calcium, more functional type things. All facets of, I think, imaging are really growing. And I think it's up to us to be able to pick it out, pick what's important, and then show the value. And really that's, you know, that's just like we're showing level evidence and what devices we use, this is the same standard, and we're going to have to get there.
Yeah. Well, do you think it's, so some of this imaging technology, is it being driven by the ability to generate computer power, or is it really more that there are some new manipulations of the techniques that are used for image acquisition? I mean, what would you say are the prime drivers of these advances?
I think you were right on, and that is, you know, we started looking at CAT scans. We started with helical CT, and all of a sudden we had these 64, and you had this arms race of slices. And really what happened is our computers weren't able to handle it. Now our computer power has gotten so much better that it's incredible what they can do and how quickly they can do it. I think, you know, the scientists and the engineers, they kind of knew what they could do. They just didn't have the power to do it.
Got it.
And now, I mean, things are coming out even with CT where, you know, they can use very little radiation and then use the computers to clean it up, take all the noise out. So, you know, if you looked at the image, it would just look blurry, bunch of dots. With the computers, they're able to filter that out and then be able to show you the image that we're used to seeing. Mm-hmm. So it's exciting, and I think you're right on. It's all really, I think, computer power, and then it's up to us to figure out how to use it.
Yeah, very interesting. So tell me a little bit about what's going to go on at ISET this year. This is coming up now in about 3 months, right? Towards the end of January. And of course, it's been a long-standing meeting. Every year, you're doing everything you can to make it as amazing as possible. Give us a little preview.
You know, I think that's the challenge, and how to make ISET fresh, where it doesn't go stale, and continue to kind of push the envelope of what really we need to know, or people need to know in the endovascular community. This year, I think sympathetic denervation is really a hot topic, and really not only focusing on renal denervation, but the whole spectrum of that disease. I think in the United States, we're going to be faced with a lot of choices in terms of healthcare, and trying to get on landscape and understanding what those changes are going to be, or something else we want to stress, along with a lot of other procedures, you know, prostate embolization and what have you, things that I think you know, have a future for us as a field, for all of us,
right.
in the vascular field.
No, that makes sense. So it's a place where a lot of new techniques are introduced every year. So it sounds like you're going to continue to upgrade that and continue that whole approach. You know? So let me just ask you a couple more questions, and then I'll let you go. But I wanted to find out about what's your favorite thing to do in Miami.
Great. You know, my favorite thing to do in Miami is really hang out in the water. I like to swim. I like to scuba dive and really snorkel. I'm almost giving up the scuba dive. I like to snorkel and see those fish in the water. I don't have a boat, so I'm not really a boater, but I do like to go out in the water and kind of swim out there and what have you. When I'm in my younger days, I used to do a lot of windsurfing, and I haven't done that in a couple of years, but it's exciting. I think that's the best part of living in Miami, almost like Hawaii, is being outdoors and being able to see that natural beauty, and that's really what I like about Hawaii. I'm in Miami and being with my family and doing those kind of activities.
Yeah, agreed. So there is one Cuban restaurant in Honolulu, Sol de Cuba. It's fantastic. You walk in, they've got the Buena Vista Social Club, they've got all the decor, the food's very authentic. How many Cuban restaurants do you think there are in Miami?
Well, there are too many to count. I think it's, like I said, it's really one of the centers for, I guess, Cuban ethnic culture. And now we have all types of Latin American culture now in Miami. So it's kind of the gateway to Latin and South America. So, you know, it's an interesting place with a lot of different cultures. I think the number of Cuban restaurants are actually probably going down as others are going up. But it really, there is a lot of influence, I think, from Central and South America, and it's it's a great place because of that. I think it just brings more cultures together.
Very good. Well, thanks a lot, Tino.
Thank you, Peter. It was a pleasure.
Really,
Thank
really
you.
appreciate it.
Thank you.